Let's start by talking about social media effective in public health monitoring. People post about everything online, including their health. Hashtags like #flu can reveal when diseases are popping up in new locations. With the right social media monitoring tools, public health organizations can even get a sense of the severity of symptoms. For example, a spring 2020 studies found an association between the number of tweets mentioning telehealth and the number of confirmed COVID-19 cases in a particular state. In the book Social Media Monitoring for Public Health, written by professors Michael Paul and Mark Dredz, explain how it works. In their book, social media offers advantages over traditional data sources, including real-time availability, ease of access, and reduced costs. Social media allows us to ask and answer questions we never thought possible. I have thought about social media is effective in public health monitoring. Now, let's move to next issue. The next issue I would like to focus on is about social media effective in citizen engagement. Healthcare issue can be tricky to talk about, even with doctors. That's especially true for subjects like mental health, where social stigma can prevent people from seeking the professional support they need. During the pandemic, Genspot created a series of resources using the hashtag #LightenTheLoad. The goal for the backpack company was to support its young customers starting in the 2020 back-to-school season that wasn't. Through the campaign, they provided access to mental health resources for young people, including a series of Instagram live chats with professional therapists. This is a good example of how healthcare professionals can partner with brands outside the healthcare sphere on social. They also provided information on how people could reach crisis support if needed. Here's another example. A coalition of more than 1,000 organizations and healthcare institutions launched a campaign under the banner "The Fight is in Us." The goal was to encourage people who had recovered from COVID-19 to donate their plasma for its valuable antibodies. Running a course of celebrity-based ads across Facebook and Instagram, the campaign reached 3.95 million people. I have talked about social media effective in citizen engagement. Now let's move on to social media effective in patient support. Researchers say that nearly 40% of young people around ages 14 to 22 have used online tools to connect with others with similar health challenges. That includes social media groups. That connection can have real benefits for patients. A recent study in the International Journal of Environmental Research and Public Health examined the effect of Facebook and WhatsApp group is supporting veterans PTSD. Many of the study participants expressed ways in which they receive support from this group. I have talked about patient support, which is our last main point about how effective social media in health education to public. Let's summarize what we have looked at so far. Firstly, we look at how social media effective in public health monitoring. Then, we talk about how social media is effective in citizen engagement. Lastly, we talk about how social media effective in patient supports. So, it is obviously show us that social media is very useful medium in health education to publics. Thank you for listening and thank you for your attention.